Hello, the subject that I've decided to do my presentation about is asthma, and I chose to talk about asthma because many reasons. It affects my family, and I was surprised to find out quite a few of the facts that I found, such as Canada has one of the highest incidences of asthma in the world, affecting approximately 3.8 million people nationally, including approximately 850,000 children under the age of 14. 6 out of every 10 people with asthma do not have control of their condition. Despite the progress made, approximately 250 Canadians die from asthma each year. It is estimated that more than 80% of asthma deaths could be prevented with proper asthma education. And the direct and indirect cost of asthma to the Canadian economy is well over 2.1 billion annually. So what is asthma? Asthma is an inflammatory disease which causes the inflammation and narrowing of bronchial tubes, leading to limited airflow and difficulty breathing. The symptoms present as shortness of breath, chest tightness, coughing, wheezing, increased mucus production, trouble sleeping or doing physical activities due to breathing difficulty. And the muscles surrounding airways have mucus glands which can become sensitive and inflamed, and when someone has an asthma attack, these muscles constrict and the lining of the airways becomes swollen and filled with mucus from having been triggered by environmental factors such as pollution, viruses, and pollen. Asthma is also the third most chronic condition affecting millions of people just in Canada. And the cause of asthma is still mostly unknown, although it can be attributed to many things. And some of these are the following: heredity and genetics, environmental factors such as air quality, smoking, fumes, occupational exposures, gases, dust, fumes, allergies, premature birth, hormones, certain lung infections in babies and young children, and obesity. So asthma is diagnosed by a healthcare practitioner after pneumonia, cystic fibrosis, and COPD and heart disease have been ruled out. Lung function tests such as spirometry tests and peak flow meter tests, along with a detailed medical and family history, will be taken to help determine if you have asthma. After being diagnosed with asthma, a treatment plan will be administered along with medications. There may be referrals to specialists, and it is recommended to pay frequent visits to your healthcare practitioner. So different people have different triggers, and so it's important for each individual to know what their triggers are so that they are able to avoid them as much as possible to keep the inflammation to a minimum. Asthma is not curable, but it is possible to manage it to live symptom-free. And there are two types of triggers. One being inflammatory triggers, which are allergenic, and then there's symptom triggers, which are non-allergenic. The inflammatory triggers or allergenic triggers can be caused by allergies to dust mites, mold, pollen, animals, food additives, cockroaches, etc. Non-allergic triggers can be from pollution, exercise, viral infections, weather changes, chemical fumes, scented products, and even intense emotions. So as part of a plan that I would recommend for my client, as well as what's usually recommended, is to avoid the triggers, both in home and outside. So there's a few steps that you can take. Let's start by inside the home. So we would consider getting rid of any carpets that can trap dust and pet dander. If it's not possible, then just make sure that they are well vacuumed and make sure that the home is cleaned often to avoid accumulation of dust and other possible allergens. Do not use harsh chemicals as cleaners or scents, but instead opt for natural cleaners and maybe essential oils, which are more gentle on your skin and lungs. If you have any pets to which you have allergies, the recommended solution is to rehome your pet. But to many, myself included, this would never be an option. So there are ways to manage keeping your pet and manage your symptoms. You can make your bedroom a pet-free area and try to keep your pets in areas of the house where there is minimal to no carpet, as well as any fabric furniture. Have someone else give your pet a bath twice a week to reduce pet dander. and you can get allergen-proof mattresses and pillowcases and use HEPA filters, especially in the bedroom. Also monitor humidity levels in your home, as humidity creates an optimal environment for mold to grow. Of course, smoke-free environment in your home, and take your asthma medications and inhalers to avoid flare-ups. For outside the home, where things are not as easily controlled, you can still check the air quality, temperature, and humidity levels of wherever you're going. Take proper precautions if where you're going may have triggers such as pets, smoking, pollen, or even crowds, to avoid viruses maybe. Again, make sure to bring your medications and have them ready at hand in case they are needed. Your general healthcare practitioner will have a medication treatment plan. Since the presentation of asthma is different in each patient and at different times of the year, different medications may be prescribed depending on symptoms. The two main types that are given are controllers, which are made up of corticosteroids, and they help treat the long-term inflammation in the lungs. And then there's the relievers or rescue inhalers, which quickly relieve the short-term acute symptoms. It's important to note as well that if you find yourself using your rescue inhalers more than twice a week, this is an indication that your asthma is not being well controlled, and you should let your healthcare provider know. These inhalers come in 3 different forms. There's the aerosol inhalers or meter dose inhalers. There are dry powder inhalers and spacers. There's also a new treatment called biologics, used to treat people with severe types of asthma, notably allergic asthma and eosinophilic asthma. Biologics use live animals, plants, or cells to treat different conditions, just like using insulin for diabetes, and they use that instead of chemicals. In the case of asthma, a plan tailored to the needs of one specific person is created so that the antibodies are used to stop inflammation and other processes that cause asthma attacks. They kind of act like the long-term controllers to control severe asthma, and it's added on top of the controllers and the rescue inhalers by means of an injection every 2 to 4 weeks. There's also something called the Asthma Action Plan, and it's another useful tool that is available to asthma sufferers. It consists of 3 zones from good management to emergency situations, so green, yellow, red, and it categorizes how well your asthma symptoms are being managed. The detailed plan is mentioned on the asthma.ca website, where there is loads of information about asthma, and also many other toolkits for asthma attacks, asthma control, children's asthma, and many more. Another thing I would refer my client to would be so the asthma.ca website, and as well there's also a helpline. So I'd provide the phone number, which I've provided in the written health package, and they also have an email that people can write to. For the forms of herbal treatments, I would use bronchodilators, decongestants, anti-inflammatories, antitussive expectorants, and antihistamine. So the bronchodilators obviously offer immediate relief from asthma by relaxing the muscles in the bronchi by lessening constriction and improving airflow. I found Lobelia inflata is a relaxing herb. Although really strong otherwise, it seems to work well for asthma, and I've read about a tincture that you can take orally. So when somebody gets an attack, if it's their first time using it, they can start at 5 drops and increase to 10 drops, and then keep increasing until these symptoms have plateaued. And next time they have an attack, they can start at the larger amount. Then a tea containing some decongestants to improve breathing by drying out the excess mucus in the airways, anti-inflammatories to reduce inflammation and prevent further attacks, antitussives to reduce cough. It could be taken maybe twice a day. So for the antitussive decongestants, I chose Thymus vulgaris, Verbascum thapsus, and Glycyrrhiza glabra. For reducing anxiety and calming, Ocimum tenuiflorum, Tulsi, Rosa. And for anti-inflammatory, I chose chamomile and also meadowsweet. And I put about 15 grams of each of those herbs for the tea. Then an expectorant for maybe when there's too much mucus and they need to get it out. So maybe another tea with eucalyptus, 20 grams, thymus, 40 grams, verbascum, thapsus, 40 grams, and this would be taken whenever needed. And then an antihistamine to reduce the effect of the allergies. So I found that Eyebright, Euphrasia roscoviana tincture, 1 to 2 mLs whenever needed. Also, obviously, if the person has some food intolerances and allergies, I would suggest that they cut them out or bring them to a minimum if possible. So a lot of inflammatory foods also should be brought down, such as dairy, fried foods, packaged foods, red meats, etc. Some people have intolerances to soy, eggs, wheat, so the main thing would be to find out where the intolerance is and go from there. Thank you so much for listening.